All right. Good morning, everyone. I'm going to get started here. My name is Naomi Schaefer-Riley, and I'm a resident fellow here at the American Enterprise Institute. I'd like to welcome everyone here to what I hope will be an informative and productive conversation about the Family First Prevention Services Act. In an era of extreme political polarization, it's rare to see a piece of legislation that galvanized the kind of bipartisan support that this act did last year. Headlines from around the country read, "This new federal law will change foster care as we know it." They called it, quote, "a chance to improve the lives of children in foster care," and "the revolutionary foster care law buried in February's federal spending deal." At the risk of rocking the boat, though, I think it's important that we don't simply rest on these laurels, but instead ask ourselves how things are turning out so far. It is still very early in the process of reform, but as with so many things that happen in Washington, the realities in the states are just a little bit different. We have brought together a remarkable panel of experts today to explain first what the promise of Family First is and the opportunities that it offers for fixing what many see as a broken child welfare system. But then they will also share what they see as some of the bumps on the road to implementation. You can find their full bios on our website, but I'm going to give a brief introduction for each one of them. Then we will allow everyone to speak for 10 minutes about their experience, and then we're going to have a panel discussion followed by a Q&A. So we're going to start with Sean Hughes. He is a managing partner of government relations for Social Change Partners, which assists public agencies and other service providers to implement policy solutions and practice innovations within child-serving systems. Mark Meekum, next, is the CEO for the Ohio Children's Alliance. In this role, he directs the association's strategic initiatives, advocacy, and lobbying responsibilities, as well as development of collaborative partnerships. Eric Bjorklund is the executive director and president and CEO of Utah Youth Village, a not-for-profit provider of programs for children and families with challenges. Marie Cohen is a child advocate, researcher, and policy analyst. She worked as a social worker in Washington's child welfare system for 5 years and is currently a member of the D.C. Child Fatality Review Committee. And finally, Christine Kalpin is the managing director of public policy at Casey Family Programs, where she supports the foundation's efforts to inform and educate federal and state policymakers to improve outcomes among children and families. So with that, I'm going to turn it over to Sean.
Hi, everybody. Let's see if this works. Aha. So thanks, Naomi, and it's good to be here on the panel today to talk about a very complicated law that we're going to each get 10 minutes to dissect. I'm going to focus on 3 key areas that I think will be critical to successful state implementation of this law. But before I get into them, I want to do some quick level setting. I don't know what the sophistication level is in the room on Family First, probably pretty broad. But the law was actually a marriage of 2 different ideas. One was the idea that we should use Title 4E of the Social Security Act to provide resources to fund services to prevent the entry into foster care. And the other was the idea that for children and youth who are in foster care already, we should curtail the use of group homes and keep them in family-based placements whenever possible. One thing that's important to remember when we talk about some of the challenges with this law is that it was not an infusion of new resources from the federal government into the child welfare system. The law was budget neutral. It actually saves the federal government money over 10 years. The restrictions on group homes freed up about $641 million in federal funds over 10 years. In combination with some other cuts, those resources were then redirected to the front end to fund the prevention services that we're going to talk about. So it was kind of a resource realignment as opposed to a bunch of new resources being dumped into the system. So the first area I want to talk about is prevention services, which was, I think, the primary motivator for most people in getting this law passed. I think it's important to remember that when we talk about prevention, we're not talking about primary prevention in the context of Family First. With some exceptions, the majority of children and families who are able to benefit from the new 4E expansion will need to be, quote-unquote, candidates for foster care in order to be qualified. And what that means is that the child needs to be at imminent risk of foster care entry. That's defined in the Child Welfare Policy Manual already as without the service being delivered, the child would be moved into foster care. So unfortunately, though we are moving upstream, we're not moving really far upstream. And so a home has to be in a significant state of crisis in order for these new 4E funds to be eligible to support the children. Now, I think there's been some confusion around the candidacy conversation. Frankly, I don't think HHS is helping by not being very proactive in trying to define this and leaving it to states. But I will say I live in California, and candidacy has been in statute for a long time. You have been able to, as a state, claim federal dollars to support candidates for foster care for the administrative costs associated with that work for a long time. And so California and other states have been proactive on doing that. If we deliver services to families who are considered candidates who are in what we call family maintenance or family preservation programs, California has been able to access federal dollars to cover some of the administrative costs, so the social worker time associated with those programs. This allows California and other states to also fund the service piece. But what we found in California is the state actually got in trouble, as did other states, by interpreting candidacy too broadly. We tried to move it upstream and draw down resources for families that maybe were not considered candidates by the federal definition. And the state was audited and subjected to fines. And so I think states are going to have to be really careful in broadly interpreting candidacy too far, lest they incur federal penalties. So what we're really talking about is, for these services, is the prevention of foster care, not necessarily the prevention of abuse and neglect. And so this inverted pyramid kind of shows you the children and youth who would be eligible for the new services, the ones who are not quite in foster care yet, but have been subjected to abuse or neglect. There's been a report, an investigation, a substantiation, and now the system's trying to deliver services so that they don't have to be removed from their parents. There are only 3 types of services that are eligible to be funded through the 4E prevention piece: mental health, substance abuse, and in-home parent skill-based programs. A further challenge will be that in order to be eligible for federal dollars, the programs have to meet an evidence base. And there are 3 different levels of evidence base written into the law: promising, supported, and well-supported. Well-supported is kind of the gold standard. In order to be a well-supported program, a program will have to have gone through a rigorous evaluation, a randomized control trial, will have not only had to prove that it could demonstrate results while the service was being delivered, but that there was an impact for up to a year after the service was delivered. The reality is in child welfare, we're lacking an evidence base for a lot of our programs, unfortunately. So this is going to be a real challenge. It's going to curtail the ability of states to draw down federal dollars for a lot of programs. Further making this difficult is there's a requirement that of the money that the states draw down, 50% has to be used on that highest level, the well-supported programs. HHS is dragging its feet, and presumably we'll have a clearinghouse available soon, but we're not expecting very many programs to be listed as well-supported. So when you have to spend $1 on every well-supported program for all of the other programs that you want to fund, that's going to tie states' hands a little bit. So I would say there's a couple different recommendations I'd have. One is both the federal and the state governments should be investing in program research and evaluation so that we can build up the evidence base and get more programs listed on this clearinghouse. The second thing is I think we need to delay that 50% requirement, that half of the funds be spent on the well-supported category, at least until more programs have had time to go through these kind of rigorous evaluations. The second piece of Family First I want to talk about it real quick is kinship, because this plays a critical role in the construction of the law. So services, the prevention services, can be delivered in a couple different settings. One, if the child's able to be safely kept with their parents in the home, this is the ideal setting. It's less complicated than the alternatives. But it also allows for a child to be moved to the home of a relative outside of the foster care system. I think this is a recognition that the limits of candidacy mean that a home will be, again, in a significant state of crisis by the time the 4E funded services arrive. So it recognizes that children may have to be removed, at least temporarily, if not longer, into the home of a relative. The problem with that is you're doing it outside of the foster care system, so there's not a foster care maintenance payment following that placement, as there would be if you licensed the foster parent. So in theory, the prevention services can also be delivered in the relative home. But again, the 3 categories of prevention services, mental health, substance abuse, and in-home parent skill-based training, probably will have limited applicability or benefit to a relative placement. If there were issues like that in the home, you probably wouldn't want to move the kid there in the first place. What we're not doing for the relative is, by not licensing them, we're not giving them a 4E maintenance payment, which would provide concrete resources to a relative caregiver who's very likely to be low income themselves. And we're denying them categorical access to things like respite care and crisis intervention that they would get through the foster care system. So a couple of recommendations I have is that states should explore the use of voluntary placement agreements. These are written into statute. Not many states take advantage of them. California is one, where a parent voluntarily gives up custody of their kid to the system while they're receiving services, and that way the 4E maintenance payment does follow the child. The other thing states, I think, will have to do is be really creative about leveraging resources from other federal programs to support these kinship families if we're not going to be placing kids there through foster care. The law does expand the Kinship Navigator program pretty significantly, which I think is a really good thing. States should get those programs up and running so that they're bringing resources and support services into these kinship homes because we want to make sure that those placements work out while the parents are getting treatment services. And then lastly, I want to talk about congregate care. So the law I mentioned tries to curtail the use of congregate care. And so by doing so requires that programs meet certain standards in order to receive continued federal funding. I think this is a good thing. I think the framework of it is really consistent with what a lot of states are doing. In California, we're, I think, 7 years into a similar state-led reform called the Continuum of Care Reform, also motivated by the idea that kids should be in families whenever possible. The challenge is that Family First doesn't really do anything to develop alternatives to congregate care. And we have to remember that the kids who do end up in congregate care typically have a higher level of need and challenge than their peers in foster care. HHS data shows us that they're 3 times more likely to have a mental health diagnosis, 6 times more likely to have behavior challenges. Vast majority of these kids have also been in family-based placements before arriving to congregate care, so we can't just assume you can put them back in a foster home, shut down the group home, and everything's going to work out. We really need to invest in the capacity of the community to serve especially kids with higher levels of trauma and need so that we don't have spillover into adjacent systems so that a placement doesn't work out and a kid ends up homeless or victimized or getting in trouble with the law and crossing over into juvenile justice. So I would suggest that the federal government and states need to invest in building up the capacity of the community. I think that involves increased foster parent recruitment. We have a foster parent shortage already. We're going to need a lot more foster homes if a lot of these kids aren't going to be in group homes. But we also need to train the foster parents to be equipped to serve a child with a higher level of need. And I think we need to explore therapeutic foster homes and other models that are designed to serve kids with higher levels of need.
Thank you, Sean. That was a very fast and very thorough explanation of a very I think you've made everybody's job on the panel much easier. So with that, I'm going to turn over to Mark.
Thanks. So I come from Ohio, and in Ohio, we're navigating the Family First Act. We are committed to maximizing it, making the most of it, and we are really impressed and we're really supportive of the goals of the Family First Act. The information you read about in the press releases and the one-page summaries. But what we found after the bill passed into law and we were presented with the kind of implementation framework, it's pretty bizarre. The way that the actual act is designed and the way that states have to transition their systems to come into compliance, let alone maximize the good opportunities. Some have coined the term that it's kind of like 2 straitjackets. With the first one being the federal government is releasing the ability of states to have federal funding to support families at risk of having their kids enter foster care. But only some families who meet certain criteria based on different definitions, and only some services that they can get, some programs that have to be eligible, and only for certain periods of time can you provide the service. And if you do all those things and you mess up a little bit, or the service is an infidelity to some certification, states could have to pay back the federal dollars that they received. So it's a very complicated framework. Secondly, when kids need to be placed into a residential treatment settings under the Act, not only are there higher quality standards for those centers, which is a good thing, there's a new regulatory framework that placements have to go through. Court approval, children's services approval, you have to provide a lot more evidence, and it's a whole new layer of red tape that's already on top of the red tape that we have in our state and that Medicaid has for those types of placements. So what this shows us is that the federal government doesn't really trust states. And there's a lot of data out there to show that perhaps they shouldn't. Have been some troubling outcomes in some states that the Federal Act is trying to address. But not so much in Ohio, not so much in California, not so much in many other states. So we're trying to maximize this opportunity knowing that it wasn't really designed for Ohio. It was designed for the whole country with some of the other states in mind. Also, what's troubling is the federal government has given Ohio and other states a waiver for how they spend Title IV dollars. We've had our waiver for about 20 years in Ohio, and it's enabled us to do innovative things, to prevent kids from entering foster care, to support kinship families who are caring for often their grandchildren who otherwise would have been placed in foster care. And it's getting good outcomes, and it's independently evaluated. Many states have this program, and it's not really addressed in the Family First Act. In fact, the Family First Act eliminates that program effective this October 1st. So that leaves an awkward time situation for many states. So Ohio has been operating under this unique arrangement that will expire in October. Then in October, we have to go back to the old way of doing things from about 20 years ago. And then in about 2 years or 3 years from now, we'll be implementing the Family First Act, which has a new set of rules. So 3 different layers, they're not the layers, but 3 different approaches to how we spend federal foster care money in just a couple years. It's part of the reason that I call this act a little bizarre. But despite that, not only are we making the most of it, but we have to. Putting skepticism aside, this act is a law of the land, and this is our opportunity to try to leverage it to not just keep our system running, but to transform it and achieve much better outcomes than we have in the past. So in Ohio, we're using a really thoughtful and inclusive approach to figuring out how to implement this complex act in Ohio the right way. The governor's involved, foster youth, alumni, foster parents are involved, and all the agencies and government agencies in between. And one of the things that we've found is that we can't really rely anymore on the federal government to fund our child welfare system as we have in the past. So our state and our governor, Mike DeWine, are stepping up right now this spring, and they will more than double the amount of state funding in our child welfare system, which is historic. Wow. Year after year, it's been flatlined or slight decreases or increases, and now, effective this July, it'll be more than doubled. So that shows that not only are we invested in transformation, but we're also kind of skeptical of just relying on federal dollars to get it done. So to plan this transformation right, not just compliance with the federal act, but actual transformation in your states, we're not going to implement the act on October 1st in Ohio. In fact, I think it's irresponsible for any state to implement the act on the first day possible. So states are given up to 2 years to delay, and Ohio and many other states have notified the federal government that they will delay indefinitely. And I anticipate many states implementing on the last day possible, which is October 1st of 2021. And one of the main reasons is because the framework of how to transform your system per the Act hasn't even been fully released by the federal government yet. The Act is supposed to come into effect this October 1, a few months from now. And the types of prevention services that we can leverage all this federal dollars for to keep kids and their families intact, we don't even know what services are eligible. The feds have released a tentative list of programs that might be eligible, but all of which are still under review and might not even make the cut. So we also don't know when we're going to be notified about what complicated and sophisticated programs are reimbursable, are fundable under the Act. So in Ohio, we're focusing on right-sizing our system, of increasing capacity where we need to, raising the quality where we need to, and readying everybody, readying juvenile courts, child protective services, the foster care agencies, the group homes, foster families, our kinship sector, so that once we press go, we actually have a system that's ready to go and maximize the Act. And we have all sorts of activities underway, and I won't give you the whole laundry list, but just to give you a couple examples. We're rewriting our licensing standards for what it takes to become a foster home. We are figuring out how to promote national accreditation to dozens of group homes who don't have it, but will need to have it to be compliant with the Act. And we are also trying to figure out how to leverage other funding sources like Medicaid to complement our system and really provide the source of funding that's needed for transformation. Because we want to make Family First's goals work, but we just aren't confident that the Act itself gives states the tools to do so. So we really want the federal government to step up to give states a viable path for implementation. We want them to be able to honor the commitment of what the Family First Act's goals are so that states can actually achieve those goals. October 1, 2019 is just a few months away, and this is an experiment, the Family First Act, but it's a over $8 billion a year experiment. I mean, that's the Title IV foster care program. And it's being tested on the most vulnerable kids and their families in our country. So if we don't get this right, not just in Ohio, but nationwide, there will be grave consequences, and not just financial. So fortunately, we have a lot of reason for hope. U.S. Senator Sherrod Brown from Ohio just introduced the Family First Transition and Support Act that I know we'll cover here in a bit. But this act is now pending in Congress, and if passed, it would provide states the funding that they need to ready their system before they go live. It'll help ease the transition from those Title IV waivers into the Family First funding structure, and it will increase the amount of kids who are eligible for federal reimbursement while they're in foster care. So that bill is the critical piece to salvaging the Family First Act and giving states a viable option for success. Thanks.
Thank you, Mark. I just want to mention here, by the way, that we actually invited a couple of folks from HHS, and they were not able to make it today, but we are going to, I think Christine is going to help us understand a little bit about their perspective maybe afterwards. But I just, we're not just trying to complain into a vacuum here. We did try to get a little bit of a response, but I think that didn't happen this time, but we will try again. With that, we're going to move on to Eric.
Thank you. It's great to be with you. I'm Eric Bjorklund with Utah Youth Village. We are a provider of services that are right in the mix, and we actually have a dog in the fight, so to speak. You'll notice the title of my presentation is the Families First Prevention Services Defunding Act. And I can tell you from being a provider that provides group homes and prevention services, there are a lot of times in the last few months when it's felt like the main impact of this act is to move money away from the states, from the federal government, and to make it difficult for us to get to it. Now, having said that, let me express gratitude to the Children's Bureau and ACF and to the Prevention Services Clearinghouse for getting us a handbook, which was released just a couple of weeks ago, or 3 weeks or 4 weeks ago, and then providing us with a webinar this last week that was very informative, and for working hard to try and figure out how are they going to accommodate the 10 or so states who are going to opt in this year. Utah is one of those. And so I don't want to sound too ungrateful with that title, but I will tell you that's how it feels occasionally from a provider's point of view. Now, a little bit about Utah Youth Village. We provide group homes, we have a treatment foster system, and we provide most of the prevention care in the state of Utah, even in the rural areas. And we've got other programs as well. I will apologize ahead of time. I put more information in this presentation than I have to give to you, and I've given handouts to all of you so you can follow along on the handouts. But I'm going to blaze through a few slides, and so for those of you who think that's horrible, I apologize because there's just no time to do all of the slides I've got in here. But primarily I wanted to give you websites. So if you're interested in some of the things I'm talking about, you can go back to these websites and access them. First off, the Utah Youth Village is a teaching family model agency. The teaching family model came as a result of massive funding from the National Institute of Mental Health in the late 60s and 70s in an effort to figure out what adult behavior makes a difference in the lives of difficult children. Now think about that. What adult behavior makes a difference in the lives of difficult children? That's the guts of the teaching family model. And the teaching family model, and on the prior slide was the website for the Teaching Family Association, if you're interested in that. The focus of the teaching family model is an evidence-based model that primarily aims its attention at the frontline staff, at the folks who are working with the kids the other 23 hours every day, as opposed to almost all the other evidence-based models that are clinical in their focus. So this is a unique, milieu-wide model, and the primary focus of the model was originally to say to house parents, we can teach you as a house parent how to act as an adult so that you'll get a different outcome with this kid than his parents did and the rest of the system's been able to get. That's the research of the teaching family model. Now, not surprisingly, that translates pretty easily to what? To foster parents. So we started teaching it to foster parents. And then, in the late 1988, early 90s, a group of in-home providers called home builders went to the National Institute of Mental Health and said, we want to make a national model. How do we do this? And they said, why don't you go to talk with the Teaching Family Association? They have an international organization that accredits its members. That's the Teaching Family Association. And so for about 3 or 4 years, we had some of the movers and shakers in the teaching family model visiting the home builders' annual conferences. And they were coming to our conferences. And so there was a cross-pollination occurring there. And what happened is Utah Youth Village and Father Flanagan's Boys Town, for example, that are teaching family model agencies, we produced a hybrid in-home service that has a home-based delivery system with a teaching family model payload, if that makes sense. So it's a structure using home-based, the home builder system was very well thought out, and how you have a social worker do that kind of work. And then we used that structure using the technology of the teaching family model. And it's worked incredibly well. And so if you want to see a real cool video, this is a website where you can go, which will give you a short history of the teaching family model. And there's also an amazing video on there of a family's experience with our Families First process. Now, back at the beginning of the Families First Prevention Services Act, maybe it was because I'm from Utah and Orrin Hatch was one of the core authors, but we had a little bit more say in what was happening in the act, and we pushed hard on the authors for 2 things. The first thing we asked them for was to make the definition of foster care broad. And we're interested in letting the states be able to fashion a service that goes between residential and basic foster care. And it's something we call professional foster care. And there are a lot of states who are now exploring this category. And the actual definition, the wordage that I once got into the act, didn't survive, but the essence of it survived. Okay? So the definition is still very broad. And the second thing we talk about is the definition of evidence-based. And I'll get to that in a sec. The next few slides are going to talk to you a little bit about group homes and the path to becoming a professional foster home, which becomes something that you could do if you're a teaching family model agency because you have a married couple living in the home with the kids. And ACF has already indicated they're fine with this, and it's had the approval, the thumbs up. I know that the KC Family Foundation has been advocating, so has the Alliance for Families and Children, advocating for this more broad kind of definition of foster care to help us handle the challenges of this act. My slides also give you some ideas about the typical issues that states face in implementing that. I want to shift now to prevention policy. And I want to point out that when I was pushing hard on the authors of this bill to back off of evidence-based, because I'd had personal experience at Utah Youth Village in trying to prove in-home services up to the standards that they're talking about. And in-home services are difficult to prove, and I'll get to that in a second. But here's what I got back. The authors kept saying, look, the Congressional Budget Office is demanding strict standards of evidence-based because the Congressional Budget Office wants to limit the funding of the act initially. They want to roll it back. And I think that's real important for all of us to remember that those evidence-based standards in the Act are as much a function of a Republican Congress and a Republican president at the time the Act was passed, and the need to limit its fiscal impact, as it is to give suggestions to states of what are the ideal kind of programs that they should be using. And I want to repeat that again because that's an important point. The evidence-based components of this Act are as much about fiscal policy as they are about prescribing to the states what is it that they ought to do. Now, I'm not saying that there isn't amazing thought in the way the evidence-based standards were articulated. I just think for those people who are making the decisions of how this Act is interpreted, they need to be keeping in mind the fact that that they should be interpreting this law as broadly and generously as possible to get as many programs as possible into the states, and let the states be the experimentation, incubation, if you will, place for these prevention programs. And I'm going to give you an example of how we could maybe take different angles on that a little later on. For you to understand some of my points, I want to talk a little bit about our particular hybrid in-home service, which is Families First. Now, we had the name way before the federal government did. And that's the actual name of our program, is the Families First In-Home Services. And in this program, a specialist goes, not a clinician necessarily, although we have some clinicians, but a specialist, a person with a bachelor's degree and a lot of training and a treatment, evidence-based treatment model that they're using. They go into a family's home and they spend 6 to 10 hours a week with that family for 6 to 10 weeks. We started out being at 6 weeks, and our first two research projects were when we were operating at 6 weeks. We've now moved to 10 weeks because of recommendations from the CDC, which is a evidence-based measurement in the criminal area for juvenile justice. And so the outcomes that we've gotten are terrific. And I'll give you just a few of those outcomes where we have seen really good outcomes with what we've been doing, and we're really pleased with that. And in your notes, you'll find a place where you can read the 3 studies that support this Act, and we believe, or this service, and we believe those studies would show, under a fair reading of the Families First Prevention Services Act requirements for evidence-based, that we are well supported. Now, from an academic point of view, that might not be the case. And that brings to the surface some of the issues that we have that we want to make recommendations about. And the first item is that academic practice does not necessarily support good national child welfare policy. And what do I mean by that? That the Act is written specifically for defining well-supported in terms of child welfare policy, and not in terms of what academicians have learned to perceive and regard as well-supported. And my hope is that the Children's Bureau and the Prevention Services Clearinghouse will interpret this Act in a way that furthers national policy as opposed to making academicians feel warm and fuzzy inside. And I'll get to more detail on my last slide where the kind of rubber meets the road on, for example, an example of 2 very different ways that they could take that. The second issue is that in-home practices don't have a lot of evidence in the literature. We're still quite new, but I will tell you that the states perceive in-home services as the power behind prevention programs. They don't necessarily, there are lots of prevention programs and they're all needed to work together, but the perception is that in-home services is really where it's going to be in terms of keeping kids out of the system. And yet there's very little research. We may be as close as anyone, and we may be 1 or 2 years away from being able to demonstrate we're well supported. And that's troublesome. That means the deadline for the 50% of services given by a state for prevention has to be well supported. That's way too aggressive, especially for Utah that's going to opt in this year. And we're very much in favor of the Transition Act that's been proposed. At least that provision of the Act that backs this back to 2026. We think that would be really smart. And then the third thing is pointing out it's almost impossible to do random controlled trials with in-home services. And that, it's an unrealistic expectation to ask us to do that. Let me talk about that one first. In-home services are government funded. They're always government funded. And because they're always government funded, that means that the 14th Amendment prohibits you from providing services to one group and not to a control group. You can't say, we're going to use 4E funding for this group of citizens, but you other group of citizens, you don't get this entitlement program. That violates the 14th Amendment. And the problem is, we don't have any other private field to go do randomized controlled trials. Now, at the top of this slide, it says RTCs, and it should say RCTs. I hope you'll forgive me for that, FUPA. Randomized controlled trials. If you look at mental health and addiction recovery services, there is a thriving, strong private business in this country where you can fairly more easily create a randomized controlled trial. But when you're talking about in-home services, you can't. That's why I pushed so hard at the beginning to authorized quasi-experimental trials in the definition, and gratefully that landed in the statute. The interesting thing is we went to Utah right when this law passed, and we said, okay, Utah, would you just look at all those kids you think are going to go into the foster care system, take half of them, and let our Families First service go to them, and the other half just take their usual course? What do you think Utah's response was? No way, that would be immoral. That would be unethical. Because Utah perceives that what we do actually keeps kids out of the foster care system. And why in the world would we just simply look to half of them and say, sayonara, have fun in the system? We won't do that. And so if you're in this field and you're trying to prove the gold standard of randomized controlled trials, it's impossible. It's very difficult. One last thing in that regard. When you're in doing in-home studies, you begin your study in the guts of the child welfare field. Right off the bat, you have 5 to 15 complicating factors with that family. If you're doing a research project for one mental health type of intervention, or one addiction recovery type of intervention, you're able to narrow that down usually to one issue, where it's much easier for you to show cause and effect, much fewer complicating factors. But when it comes to in-home services, you're starting off with a myriad of complicating factors. So the playing field, in terms of research, is graphically uneven when it comes to in-home services. Our recommendation to the Preservation Services Clearinghouse, get real about this. Understand that for in-home services, where we see a lot of the power of prevention services in the future, you need to become realistic about what kind of research we can present to you. Interesting, and I'm going to skip through this, but as you look at the kids in custody in Utah, 0 to 5, 38% right now. Who are their parents? Drug-addicted adults. How effective is in-home services with people who are high? Bingo, not at all. People have to be sober. So as you're looking at how do you allocate these, it gives us a sense of the complexity of figuring out the system. I'm going to zip right here to the very end, which is to broadly construe the language of the Act. Let me just point out that in the Act it says, for you to have a well-supported practice, you have to show 1 year of effect. Two words that are conspicuously absent from that paragraph are evident or statistically significant. Now, as I say that, the researchers who are listening to this will be going, what? You can't be telling me that you're going to think that that's just talking about effect as opposed to statistically significant effect. And I'm telling you what the statute says. The statute says only effect. It ought to be okay to have a .06, a .08. And the Children's Bureau, my recommendation is you have the power to make that decision. You should make the decision to be as broadly interpretive as possible so that we can get the most programs to the state, as opposed to worrying about academicians feeling good. Thank you.
Thank you so much, Eric. We're going to turn it over to Marie.
I think I get
She
it.
needs a clicker.
I get it
Ooh,
back.
good.
And how much time do I have, just so
We
I know?
have
because-
until 11:50.
Oh, you mean that came out of my time? Okay.
All right. We'll say 11:51 just to be generous.
All right. Thank you. Thank you. Okay, I'm just waiting for my slides.
have to push.
I have to push this. Oh, see, I'm brand new to this. Aha. Okay, great. So let me just say why I do feel a little bit of imposter syndrome here. So let me give some justification for my being on this august panel. I had 5 years of experience on the ground as a social worker, and before that, I was a researcher and analyst. I even worked here with Doug Besheroff for a while, but I never worked on child welfare. But I always was very passionate about it. So after I had worked as a social worker in foster care for nearly for 5 years, which nearly killed me. I was 50 years old at the time. It was kind of like parenting 10 kids who all had very difficult problems. I had lots and lots of ideas for changing the system, so I decided I would devote the rest of my life doing that. So I created this blog that's now called Child Welfare Monitor, and it's been growing in readership, and I've been very grateful for that. And Naomi saw it, and thanks to that, I got invited. I do some things on the local level, and not only the Child Fatality Committee, which isn't as relevant to this, but I'm on the citizen review panel for our local child welfare agency, the Child and Family Services Agency. But I still feel like a little bit of an imposter, so I'm very grateful to be on this panel, and I'm also very grateful that everyone has pretty much told my whole story, so I may take less than 9 minutes after all. Yeah. So Family First Act is based on a lot of myths. And I just think somehow child welfare, maybe all disciplines are equally prone to myths. But I've noticed it more in child welfare than on other fields that I worked with. There are a lot of myths. It seems like a lot of people who are making policy in child welfare, after having been a social worker, I get the feeling that a lot of them have never met a foster child or a foster family or been to a group home. I'm just like, where are they getting these ideas? They're so wrong. So that's kind of the perspective that informs a lot of what I write. I just try to bring the on-the-ground perspective into things. So I just thought I would structure this talk around the myths that informed Family First and how we can perhaps try to make it work nevertheless. So I'm going to talk about two areas that other people have talked about, the prevention area and the congregate care area. So in terms of prevention, and this has been very well covered by Sean, it's not really, Family First is not about prevention of child abuse and neglect, except in the sense that it is really about prevention of foster care, which it says in the Act, but by putting it in the title the way they did, it makes it sound like it's about prevention of child abuse and neglect, which you can say it's what public health specialists call tertiary prevention, so it's preventing a recurrence. But I think most kind of normal people, lay people, think of tertiary prevention as treatment. So it's like saying that drug treatment is drug abuse prevention. It's just kind of, I think most people realize this by now, so I won't spend any more time about it. So I think one of the most, maybe the most important myth of all, I think, was already referred to by people when they talk about the end of child welfare as we know it, which Naomi, I think, mentioned. The underlying myth is that states are not currently providing services to prevent foster care. As soon as there's any problem in a family, they just come in and remove the child. And that's why we need to have a provision where they don't have to just remove the child, they can actually provide services to keep the child in the home. So the reality is that that's been going on for many years. And this goes back to Sean had a much prettier diagram. I don't even have anything pretty, but he had this beautiful funnel. So this is the same data. So at the top of the funnel was 1.332, or maybe it wasn't exactly the same. This was duplicated count, but this is how many children received services after an investigation or alternative response in 2017. And it is a duplicate count, so it's not my favorite way to count. But out of those 1.3 million children who were recounted if they had another investigation, only 201,000 were placed in foster care, so that was 15%. The other 85% were receiving in-home services. So this idea that we're changing child welfare as we know it is just not true. We're just putting more restrictions on it. Maybe we are allowing now, the change is now that Title IV funds can now be spent to provide these in-home services. Before that, states had to find other sources of money, but they were there. States were spending TANF money, they were spending child welfare block grant money, and of course they were spending their own money as well. So, and states and localities. So it's not changing child welfare as we know it. Yeah, and this goes back to what Eric was saying, that we know how to prevent child maltreatment recurrence. We know how to do this tertiary prevention thing. So the main child welfare clearinghouse right now that I think the Family First framers had in mind was the California Evidence-Based Clearinghouse. And they don't even have they have like zillions of categories. You can be proven to be evidence-based in so many different categories I can't even tell you. But they have primary prevention and secondary prevention, but they don't have tertiary prevention. I've only seen a few programs that have had promising results, and those were all home visiting programs. And I accept what you said, that it is really hard to get a good evidence-based study of in-home services, although I also think that it can be done because in maybe Utah is just wonderful in that they managed to serve all their kids, but in states like New York, for example, where they did Healthy Families America, well, of course that wasn't exactly in child welfare strictly, but usually there's not enough money to provide this service to everyone, so you can have a randomized controlled experiment because you don't have enough, you can't serve everyone anyway. But for whatever reason, we have very little information, as Eric said. One thing that I'd love to talk about more with Eric is that many parents, and he talked about this a little bit with drug abuse, many parents have such serious problems that the idea of someone being in the home for 10 weeks, as wonderful as I think his program sounds, that is not going to be enough for some of these parents. As a social worker, one of my jobs was to I was a foster care social worker, and so the judge would say, okay, Mom, if you want to reunify with your kids, you have to have a court-ordered psychological evaluation, which would be like a 3-hour, very, very in-depth evaluation with a professional, usually like a PhD psychologist. And these evaluations would come back with like 4 different personality disorders: narcissistic, antisocial, borderline. We don't really know how to treat these very serious disorders. They often come from lifetimes of trauma. So the idea that we know how to do this, certainly there are some people who are just having a temporary crisis and we can help them, but I think we're helping them now, so I'm not sure about how much more is going to be done because we now have Family First. I also feel really strongly, somebody mentioned the Title IV waivers. I guess it was Mark. Nobody has, on the federal level, on the national level, nobody has done a report to say, okay, how successful were these waivers? Apparently yours was really successful. I can tell you the one in my jurisdiction, the District of Columbia, I've got the most recent report. It was a total disaster. I mean, there were two core programs in the waiver. One of them was home builders. That was such a disaster. They served somehow nobody ended up being in the program. And so they dropped that halfway through. And then the other core service was something called Project Connect, which is, I think, promising on the evidence-based scale. And that program, they were on the verge of dropping it because it was almost nobody was getting into it or completing it. But they ended up not dropping it, and actually the director said that said in a hearing that they didn't drop it because they needed evidence practices for Family First, and which they are implementing on October 1st. So I am going too slowly. I'm really sorry. So I'm going to go really fast now, and I'm going to skip. I think. Yeah, I just want to say one thing. This is like my pet peeve about it only funds 3 kind of programs, and parent skill-based training, mental health, and drug treatment. I have some other programs I'm really interested in, and one of them, and you can ask me about this in question and answer, I think early care and education or early childhood education, there are so many pathways by which if you put all those kids in full-day, high-quality childcare, that's where I would put all my money. You can ask me about it later. Okay, and I won't go. I'm going to skip right to congregate care because I have been too slow. I normally talk fast, so I'm trying to talk slow. Okay, so congregate care. The main myth here, maybe I won't even get beyond this one. Family foster care is always better than group care for most kids. I'm making a similar point to Eric here. You can't do a controlled experiment. Okay, I'm going to put you in group care and I'm going to put you in foster care. So this is all based on all this research that says kids who go to foster care, kids who go to group care do so much worse on every outcome, whether it's criminal justice, whether it's welfare receipt or teen pregnancy, doesn't matter what, unemployment. So yes, right. That's because they're a totally different population. Who goes to group care? The kids who are more troubled. So we don't have data on this. To me, the most important thing is quality, not category. He talked about the parent, the teaching family model. That is an absolutely wonderful model. It has house parents. Teaching family homes, I happen to have intimate knowledge of Boys Town here in D.C., which is a teaching family model. Their home, I would much rather put my child in their home than in many of the dark, dingy foster homes that I've seen. They have house parents. They are beautiful. There is so much support. What matters is quality and not category. A group home can be more home-like than a foster home. There are some kids who can't thrive in foster care. Some kids don't want to be in foster care because they already have parents, but their parents can't take care of them. And so they don't want an alternative mom and dad. I have known many kids like this. Group homes can also keep siblings together. If group homes can be changed into foster homes, I'm all for it. So I hope that happens. That's great.
Marie, we're gonna
Yes,
have to let
okay.
Christine
so I will stop.
jump in,
I'm sorry,
but we are gonna have opportunity for discussion
Sorry about that.
and Q&A too. So I totally understand.
All right, thank
But
you so much.
Thank you. Okay, Christine, 10 minutes. Thank you.
No, that's fine. And I want to begin by thanking you, Naomi, and the American Enterprise Institute for the chance to be here today, to be with my colleagues on this panel. Oh, I don't have slides, so you're good. So I want to begin by a statement that I'm afraid may put me in the minority here, but about expressing my profound enthusiasm and gratitude for what happened with the passage of the Family First Act, and really to express what we've seen in enthusiasm from states, from foster youth who shared concerns, from birth parents who talked about their real challenge in being treated well and having their services met by a system and by others, and the real opportunities that this prevents and makes for us to really talk about what we want for our children and families in this country. For decades, the federal partnership with states who primarily have responsibility for the care of children, for all decisions, for funding, and for determining what happens to them, has been one where we say, we will join with you if you decide that child needs to be in foster care. Outside of that, any funding will need to either come from other programs or limited funding we would provide via Title 4B, which provided flexible funds for states intending to support prevention activities. And that's about $800 million that's been available since the 1990s, but largely against the offset of $8 billion in foster care. You're talking about, almost $8 or $9 in foster care for every $1 in prevention. We were not spending dollars the way we wanted to. What did Family First do? It said, first and foremost, foster care remains an important area for the federal government to invest in, and we are going to continue that investment. We are going to continue to reinforce what federal policy has always said, which is children should be in the least restrictive settings possible. That has been federal policy for decades. That said, foster youth, birth parents, and others came to Capitol Hill, they came to meetings, they came to conversations with policymakers and talked about their experiences and where they were being served, and in particular, the challenges with placements in group homes. So federal policy said, we recognize there's a place for group homes, but we need to make sure if a child's in a group home, it's appropriate, this is a quality setting, and that someone is making sure that when that child and family leaves, they continue to get services. It really was intended to drive the quality type work that Eric is doing. I think the kinks he's highlighted are important for us to have a conversation about, but this was about defunding placements for children who didn't need these types of placements. So I would agree with you on the choice of defunding. I don't think it was a choice to defund a type of setting. I think it was a choice to be sure that children, first and foremost, were being served where they needed to be. And that's also the spirit of the prevention services. This, again, wasn't about saying, if there's a safety concern that you believe cannot be addressed in that home, that child should be placed in a temporary safe haven. They should be placed in foster care, and it should be temporary. But we know, and children would come to the Hill, to caseworker meetings, to our forums, and talk about, I needed you to help my mom. That's what I needed. I needed you to help my parents. We know that kids do best with their families. The majority of these children who age out of foster care find their families on Facebook, on Instagram. They find them. Families are fundamentally what drive this country. And this is about making sure that we remember that when we fund activities and outcomes for our kids. And that was what the federal dollars were intended to do. I don't disagree that we want prevention to go further than it already does. It's important, but it would be a missed opportunity if states were building child welfare systems based purely on meeting family first requirements. That was never the goal. That was never the intent. This was about giving the states a tool to drive visions and to drive transformation. I encourage you all to look at what DC has done. DC has submitted the first preventive services plan to begin drawing down resources, but they did so in a way of making the District of Columbia a family-first community and recognizing that what the Family First Act, a federal law of funding, will provide is going to be a small component of what they recognize their families are going to need. This is about wrapping Medicaid around these families. This is about wrapping the maternal and child and infant early childhood home visiting programs around these families. This is not about family first being everything, but this was about families coming first and us thinking differently about what we did when we responded to a call. That these caseworkers had the tools they needed, that we structured the systems the way we wanted, and that communities and services were driven by this. We learned a ton from the waiver programs like Mark talked about in Ohio. They've been operating for 2 decades. But the waivers were a tool to drive state innovation. All of this has always, though, been about whether we're making the right choices. So I do encourage you to look at the demonstration evaluations of the waiver programs. There's a considerable amount of information on the Children's Bureau about the various projects and what you can learn. Those programs that didn't work weren't about a waiver not working. They were about whether it was the right program or the right service. And so what's exciting today is that we are seeing states use data in a new way. They're really trying to identify what families need. I think all of what's been discussed here in terms of opportunities is critical. And before we do go, I do want to Naomi's point, talk a little bit about what we have seen with HHS. I think what's really positive about this is this is an administration fundamentally focused on driving a conversation about families and prevention. And that's incredible because if you've heard Assistant Secretary Johnson or Jerry Milner talk, they have been relentless in talking about families and children being at the forefront of what we do, and about looking at the regulatory and statutory areas that prevent all of you from doing the great work, and that's tremendous. I think what's been exciting about where we've seen Family First guidance in this space is that when they can, they've always erred on the side of flexibility. They have always erred on trying to be as open as possible. I think there are some kinks in the clearinghouse that we have to work through. And there's no question that we have heard states repeatedly talk about the number of programs and services that they believe qualify. We've done a review of programs and looked at this, and we identified 67 that we felt met either a promising, supported, or well supported. There's more information out there than we think, but we do have to really make sure we're looking at the end of the day at making sure nothing is more important than a family getting what they need. So the key message to walk away from this is all of the conversations with HHS and all of their work has really been about making sure, again, we don't push states to build 12-month prevention programs. Families should get what they need for as long as they need. Family First will fund some of that. States will have to figure out how to fund the rest of that, or we'll have to sort of keep doing that. But what's exciting is these conversations are happening. They're happening at the state level. We are seeing a lot of states interested in moving this act forward. If you're in a state, talk to stakeholders, talk to your directors about what they're doing. Ohio, Colorado have steering committees. I mean, this is generating also the type of community engagement that we want. So it is a real opportunity. I'm thrilled to be here, and I'm excited to talk more about how we can keep moving this forward.
Thank you. And thank you for being quick. I'm sorry to all the people at the beginning. Well, whatever. We won't assign blame. We'll think more about prevention next time. All right. Well, I just wanted to start off a little bit of discussion among our panelists. And the one question that I think all of you have touched on a little bit is how much faith we should have in the prevention service programs. And when you think about it, I hate to have you put a number on it, but when you think about it, how many of the families that we're talking about, what percentage of the families that we're talking about do you think could be helped by one of the programs? I mean, Eric mentioned that there was obviously addiction is a huge driver of child removals, and we don't have, as everybody knows when we talk about addiction, we don't have a foolproof plan for getting parents off of drugs. So what percentage of these families do you think could truly benefit from programs that are either out there already or the programs that have already been determined to be evidence-based? You can start anywhere. You want to start with Sean?
Oh.
Sorry.
Sure,
Okay.
I mean, could be helped? Probably a lot. I think the worry is that the restrictions on candidacy may mean that the help comes too late. Mm-hmm. I think the restrictions around the evidence base may mean that the program and the types of service categories may mean that the programs that are available don't fit what they need. I don't know how to quantify it, but certainly there's the potential for a lot of help. I don't know how this all plays out. I don't think anyone knows how this all plays out yet.
When advocates, and when I first read drafts of the Family First Act, I interpreted it as meaning states will be able to provide mental health, substance use disorder services, intensive family services, and other kinds of services to help families on the brink. And I would argue that 100% of families that are in that reach that stage could benefit from a range of services that are evidence-based or almost there. And I know I'm preaching to the choir on the stage, but the act itself limits what those services are so much, whereas if it was more flexible, then we wouldn't probably be here today. So that's what I'm hopeful for, that I think it is, the opportunity truly is out there. It's just being able to connect the dots between the opportunity and actually being able to leverage the act to provide services.
So we see, if you take all of the families who receive there'll be 480 families this year, and you average their outcomes, just a straight average, you see a 27-point drop in an instrument called the YOQ. That's 2 times statistical significance. That's 2 times the clinical movement. So when you get in-home services into a family, you have a real potential for making change. And you don't need to change mom and dad, if there is a dad, a lot. You just need to change 1 or 2 parenting strategies that they have, and you get huge payoff in terms of the kid. So the whole business that we're going to make them a bank president, no. They can still be, dad can still be an alcoholic. If he can learn to do this, one parenting, we can make a huge difference for that kid. And that's what our studies tend to show. The substance abuse is a huge issue for our nation. And what we would suggest is that a lot of times, if you can do these programs in tandem, we see terrific results when we can have dad with a mental health counselor, and we can have him with addiction recovery, and then mom with the things she needs in terms of concrete services. And then we're doing family preservation work in terms of helping them learn a few different dynamics. That combination can be very powerful, and we're hoping to see that roll out. I know that the Children's Bureau is making an effort to be as flexible as they can, and I really appreciate that. You're hearing my voice wanting to push them even further, because I am hoping that the typical researcher academician will spend 2 or 3 lectures explaining why the evidence-based definitions in the Families First Prevention Services Act are not what you should be doing in academia to prove well-supported. In other words, the whole notion of what is well-supported in academia is not what well-supported means under this act. What well-supported means under this act should be read as just what we need. It's kind of what we need to hop over to get you into the state and get federal funding. And the act should be read as broadly and generously as possible. And I'm kudos to the department. It's obvious from the workshop they did last week that they are reading it literally, and I was a little concerned that they're reading into the act a few things that are academic. And how can you blame, if you spent your whole life in academia and you're using the word well-supported, and it's well-supported with 12-month outcomes that may not even be statistically significant, that should cause you to not sleep at night. But my point is, the purpose of the act is not to make life easy for academicians or to reconcile their conflict with the act and what their focus is. The purpose of the act is to get out prevention services for everyone. And I am quite hopeful that we can make a big difference.
Okay. I'm going to start with a new question on this end, just so we can get to one more question before I open it up to the audience. Christine, I wanted to ask you about the question about congregate care, how we are defining it, and whether, as Marie says, it sort of gets a bad rap when sometimes it really is the best option for kids. I know a lot of legislators really, talked about, they had heard these horror stories about institutions, and a lot of their motivation behind passing this act was this idea that we're going to close these down or make sure they don't get federal funding. But obviously, as Eric, talks about, there are great models of group homes out there. So how do we, get people to make those distinctions? And, what do you think we could do to sort of help people better understand what the congregate care landscape actually looks like?
So thank you. I think this has been one of the more challenging areas to really educate about for all the reasons you've talked about, which is there should be nothing more important than making sure that a child's needs are met. And federal policy should support that. And I think a lot of the conversation in Family First has been mischaracterized as group home care is bad. No, group home care is inappropriate for a lot of children and for whom are there. And children should not grow up in group home care, right? And so I think if we can reframe exactly what we think is important about group home care, we can get to a better place of the conversation. Because the reality, too, is that in the majority of states, you're talking about less than 12% of their children in foster care, even in group home care. The states are driving this forward. The best ideas don't normally show up in federal law for the first time. A lot of what's informed here is because states drove policies around the need to drive accreditation. There are state child welfare systems who have purely fund these placements through Medicaid dollars. If we are talking about medically and behaviorally challenged youth, they should be in medically and behaviorally approved facilities, and those should be medically funded. We were responding more to those children who were being placed in group home care because of the lack of foster homes, and that's a very worthwhile conversation to have. That's one to have a conversation about. The challenge of very large sibling groups, what do we do with that? I think Family First recognized all of that. There are exceptions related to sibling groups. There are exceptions about this. There's a recognition that there are special facilities that serve youth who've been trafficked, right? I think looking and really understanding where we can go with this is important. And what's going to drive this largely at the end of the day is also just the reminder that it's important that we're doing what's best for these children. And all of what's in federal policy is intended to support that.
Lori, yeah.
Well, I think I'm going to take the opportunity to get to the one slide I wish I had done. So I feel like there's this magical thinking that if we close, it's kind of like if we build it, they will come, but it's kind of the opposite. If we close group homes, foster homes are going to just magically appear, you know, and I think it's irresponsible. It's kind of like when we close the mental institutions and then the community placements were supposed to magically appear, but they didn't. So those people are still out in the streets today, not far from here. And so I just feel like that's irresponsible, and I feel like you're absolutely right. States are driving it. You're absolutely right, and that's why we can see what's happening in all the states. And I've been writing about it. So in New York, in New York City, there's a big scandal now that children are staying up to a year in this emergency shelter where there are like guns and knives and God knows what. And one kid in a wheelchair has been there for a year. Well, they closed a bunch of group homes, and that's what this was attributed to. You know, so when you have to do step A before you do step B, but then you don't do step A, I don't think that's the right way to make policy. Then you'll have the kids going out of state, like in Washington and Oregon, which mostly because of funding, which I think is behind a lot of this. Group care, especially high quality group care, is expensive, so they stopped raising the rates. And so now what they have to do is send their really difficult kids out of state. So yeah, the states have been driving this, and now the federal government is jumping on board, but I don't think it's the right way to do things.
Okay. All right, great. Well, we're going to open it up to questions. There's going to be a microphone coming around if you can wait for it, and then tell us your name and please ask a question. Right here.
Thank you. My name is Ryan Hanlon with National Council for Adoption. I'm hoping that the panel can address the impact that FFPSA is likely to have on adoptions from the child welfare system.
Yeah, I think it's a big under-discussed issue. The delay of the D-Link for the adoption assistance program for those younger kids will have an impact. It freed up also significant resources that could be redirected towards the front end, $505 million. So I think people forget it was, in a way, a $500 million cut for adoption services, unfortunately.
Further, another big impact on adoption, or rather another big opportunity for adoption, is to provide preventative services to newly adoptive families to prevent disruptions. And if we can ensure that the prevention services that are fundable through this act are broad, then that could really make a dent in decreasing adoptions that disrupt.
What he said.
No, and I think it's important to focus on that because policymaking is always about choices, and I do view sort of the act a little differently than Sean in terms of it being budget neutral. Family First actually wasn't a budget neutral piece of legislation. The Congressional Budget Office is predicting that the states are going to draw down $1.5 billion in the prevention services, and so most of the money in Family First was there. By moving in a broader budget package, it allowed actually a lot of other federal money to go in, and it's a lot of behind the scenes making on this. But I think this is largely also why most of the adoption community signed support letters in support of Family First at the end of the day, because they saw the opportunity for post-adoption services and to support adoptive families as a piece of this. And it's delaying the adoption assistance D-Link, and that is unfortunate, but it isn't going away. So the dollars will come back, and it's always about trying to take steps forward. And I think these are, to everybody's point, worthwhile conversations.
So you think the prevention services for adoption will be?
Well, it's both the law and the committee language were very clear about this notion of the candidacy really being about, children in homes, that could disrupt, and supporting adoptive families. So they were specifically called out as an area for attention. So I'm certainly not going to argue it's a one-for-one, and I know that this will impact states in varying ways. I think the impact on families is important, and I think it is an important conversation to be having. But,
a question right there.
Hi. So my name's Lisa Pilnick, and I'm a consultant to organizations on child welfare, juvenile justice, and youth homelessness, so that will probably tip you off to my question. So Sean, on your side, you had like a little box that talked about the implications of potentially pushing kids out into other systems. I'm wondering if I can ask for you guys to share what you think are some concerns and also some opportunities. Looking at you, Christine, because you might be the only one who answers that. But I'd like to hear where you think are the concerns and opportunities in terms of kids who either are already experiencing homelessness, involved in the juvenile justice system, involved in behavioral health systems, but not child welfare, and for kids in child welfare currently who may end up touching those other systems.
Want to go first?
I'm happy to start, sure. Well, I think first, another piece we don't talk nearly enough about that was in Family First were a lot of steps forward in the Chafee Foster Care and Dependence Program that included extending foster care, extending the ability of states to suspend services for youth who are older and aging out. So I just want to take a moment to expand on that. I think the opportunity here fundamentally gets to this conversation about what do we mean by a candidate and actually how restrictive is this going to be. I'm actually heartened by the fact that the Children's Bureau has decided not to release guidance around this and to say we're not going to define this any further. We want you as states to talk to us about who are these children and families at risk of coming into care and how are you going to identify them. It, of course, raises all the challenges Sean and them identified because the history of inappropriate claiming and things getting approved and then no longer being allowed is very real. And so I do think there needs to be a conversation, but I think what's important about that is what you raised, is the populations of our children, we might define them as child welfare, but they could also be in the homeless or they could be in JJ, and oftentimes how we define them is more about how we responded to them versus what their challenges are. So I think the opportunity here really is to bring the juvenile justice community and the housing community to the table with child welfare to really think about how are we going to build a system that supports our families, because all of this is about getting in front of that and getting in front of addressing all of those issues collectively. And so again, opportunities. The challenge, of course, will be this is only going to take them so far because of what preventive services are being funded in Family First. But I do think, examples like DC are tremendous to look at to understand how they're bringing the housing authority and how they're bringing their juvenile justice programs to the table and think about this is about blending and braiding money, and that's what this can drive.
I think the Chafee expansion was great. Unfortunately, there was no money to cover the expanded population. So in states like California, where you have already insufficient funds to cover the previously eligible population, we're actually not going to take the expansion because it's just further diluting the pie. I think one other issue that is sort of California-specific, although some other states may do this, is we have a more integrated, I think, JJ and foster care system than some other states. And we have historically used group homes for the probation-involved youth. And it's often a step down from locked detention, which is more restrictive, back into the community. And we've been undergoing a process in JJ in California for a number of years to make things less punitive and more restorative and make everything more community-based. And to the extent that those group homes that previously served children coming out of JJ are not QRTP eligible, I think it takes away one of our tools, unfortunately.
Right.
So could I just talk a little bit about our experience? Families First in Utah, the in-home service, provides services to DCFS and to JJS and to the juvenile courts who have their own little pot of money. And that really helps us move this service out into the rural areas because we have three essentially different referring agencies. And it's essentially the favorite program of the probation officers. And so the concept here is that prevention services like in-home services, which can be quite flexibly used, translate very easily across those three areas. We have 3 studies that support the effectiveness of Families First. 2 of those studies were done in the juvenile justice system. And so the most recent study shows 12-month effects in reduction of rebelliousness, attitudes favorable to antisocial behavior, attitudes favorable to drug use, and then an increase in belief in moral order. And all of those are statistically significant. So when I'm pushing about the 12-month statistically significance, that's not our issue, but I think generally that's an issue that may keep a lot of very deserving programs from being into states, and it's not written into the statute. And so I'm hoping that that doesn't get read into the statute. But I think those 3 fields certainly equally benefit from prevention services.
Well, just to build on what Sean said, I just had a heartbreaking conversation a couple of days ago with 2 amazing women, the executive director and the social worker from the Plumfield Academy, which I don't know how many years it has been operating, and they take both juvenile justice and it's in Sonoma County, and they take the most difficult to serve boys, and they're boys who grew up there. And it is just an amazing program. They're shutting down. The state was determined not to let them qualify as an SRTP, I guess the California word, and the word is, and they finally just gave up. And this was the one, so in California you have these juvenile justice commissions that review all the homes that their youth are placed in, and this home, Plumfield, it got I can't remember if 1 or 5 was the top. Every single category that they reviewed was the top. Every single category. It was amazing. I mean, these cottages of 6 kids, therapy on campus, just everything about it was just, they had such amazing successes, and now they're closing. And that's what I'm just worried about. I'm just worried about where are these kids going to go when they step down. I had a client here in D.C. who stepped down, and I couldn't get him into a group home. He was stepping down from, I guess, a residential treatment center. I was told I had to put him in a foster home. So our placement person had lied to the foster home. So I got there, and when she found out where he was coming from, she said, "You have to take him away," So it's like, that's again like what making policy when you haven't ever been on the ground. I just feel like we shouldn't let these precious programs that these people has dedicated their whole lives to helping these young men who come back now, who are like cops or in their military, they come back and say thank you, and that is closed now.
Another question? Oh,
yeah.
Sorry.
Can I clarify one thing? Because there's no requirement in Family First that certain facilities have to close. There's no expectation on the state front that they have to be doing anything other than what's in the best interest of a child and funding those programs they think meet those needs. This, again, is about what federal dollars will support and the types of placements that we think are appropriate. But I do just think it is important that we understand there weren't requirements about closing homes. There weren't requirements about how many children could be in homes. There weren't requirements about how long these children could be in homes. There are added, expectations that if they are in these homes for over 12 months, people are revisiting this, that this continues to remain important. But I just wanted to have a chance to sort of make that point, because I do think I think your point's very well taken, Marie, because I think the challenge of the programs in juvenile justice and child welfare has been real, and there's been this whole conversation about where funding comes from and the best way to support these youth.
Question? Yeah, right here.
Thank you so much.
There's a microphone there.
Yeah. I'm from France, and I moved to United States, and I'm with UNESCO. And I'm invited to get involved this time in Africa, where, as you know, the youth is out of job, out of everything. But most relevant, and thank you so much, because most relevant has been my experiences in Scandinavia and in Switzerland, in Geneva, precisely. Our conclusion, there's no scientific conclusion. I mean, the scientific facts have proven to be, most of the cases, either irrelevant or not guiding us to solutions, whether in Norway or Sweden or Switzerland. The idea, finally, is to conduct experiments. We did conduct those experiments with children with problems in families, and to have shared activities out of school, after school, families with children with problems, or sometime institution, to have them integrated in normal activities with all our children, other children in the community. My question is it relevant to the United States to empower families, to help them discover opportunities for their own children, these shared activities in what I would call shared community facilities like museum, libraries, or outdoor activities, sometimes in their local cultures like forest thing cultures in Scandinavia, getting involved children with families. We did not ignore the problem, but we did not investigate the problem they might have. We had very encouraging results sometimes. A case in Geneva, a child with autism, it was a very difficult situation, so we just got him integrated with the family in so-called normal activities.
Does anyone have any?
In museums. So my question is it relevant in the United States? I'm involved with Smithsonian in some project, or the Library of Congress, the World Digital Library. To me, at least I'm testing this idea, is enrich after school, out of school activities by getting involved the whole families and the family, whatever level, give
I think we
opportunity
I have
to cooperate.
I want to just give it to the panel and see if we have any answers. Is it, I don't know if this falls into the category of preventive services or where
well,
you
I mean, I think where it falls is more work done a few years back here that on Capitol Hill, that again informed by states, but driven more by a conversation that sort of has a framing of normalcy. So there was a whole discussion in child welfare about what we do for our foster youth to allow them to engage in activities with their families and to support them. And so I do think federal policy has taken the step to recognize that children do best with their parents, that by supporting the unit together, there's a lot to be done there. It's not really an allowable, unless to the extent I'm not completely, I'm sure there may be programs in the in-home parenting skills and in others that have similar components of what you're talking about. So I think it's a recognition, and I think, so that's what I would offer.
I actually like your idea, and I think it does relate to another slide that I didn't get to or I wanted to be asked about the child care. So, I really think that so many, by far the majority of the children who come to the child welfare system are very young, and a lot of them are even below school age. And the first thing I would do, I would require every in-home, every family that has a child that's a candidate for foster care, I would give them access to the highest quality preschool. And I think that relates to what you're saying, because it does so many things at the same time. If it's a high quality preschool, they would be getting a lot of role modeling and nurturing from the staff about how to do better with their kids. The kids would be just away from the parent, and this is why I like after school as well. I would put them all in, all the school kids would have after school care as well. Just fewer hours in this home with these very stressed, burdened parents. And then also, when we're talking about child care before school, the stress on the parents because they don't have child care, is just incredible. So that, I'm sorry if I used that to lead into my one of my pet causes, but I think after school also should be just routinely given to all families where their child is a foster care candidate.
Could I just speak to the general concept in this country of child welfare has been that you should focus your attention on the child and separate the child from the parents who are at fault. And that is just not proven to be effective. I mean, we have 30 years of experience in group homes of our own and foster care and in-home services. And let me tell you, when you can get mom or dad to change, you get lasting, powerful impacts. So I think the real variable here isn't other programs or after school or, the real variable is how do you get mom or dad some help in terms of parenting. I have 5 kids, and I can tell you that one of those kids was beyond my parenting capacity. And I think most people who have kids have at least 1 or 2 that push them pretty hard. And so this isn't about parents being at fault. It's about giving them resources that help them come up to the parenting capacity for incredibly difficult kids. And essentially, that's what the teaching family model teaches you to do. It shifts you as an adult so that you can actually do things in kind of a Rambo superhuman parent kind of way. And anything we do that involves parents over the long haul, that's a permanent solution that works. And I hope that this act moves us even further into that. It should, into that direction.
That's going to be our last word. So thank you, everybody, and please help me thank our panel.
I learned a lot.
Thanks, guys. That was really good. Yeah, I learned a lot. Wow.